going to teach you today one of the trickiest injections of a fertility cycle. So, first thing you do when you're given any injections is you wash your hands and you make sure you have a clean, clear, dry surface to work on. We want to make sure that even though it's not a sterile procedure, we're keeping it as clean as possible. So with the trigger shot, this is the key to your ovulation. After this trigger shot, 36 hours later, you're going to ovulate. So it's important to time it correctly. If you're doing an insemination, we time your trigger shot 36 hours before your insemination so that as you ovulate, the sperm is coming in there to greet your eggs. In a IVF cycle, we give you the trigger shot 35 hours before your retrieval so that before your eggs come on out to meet the sperm, we can collect them and put them safely with the sperm to make embryos in our laboratory. So as far as the medication is concerned, there's a couple different medications that you may be ordered for this or prescribed for this. One is Pregnyl and one is Novorel. It could be a generic version. Human chorionic gonadotropin is what it's called. Pregnyl and Novorel are just brand names. So right now, this is the box for Pregnyl. Typically, we've been ordering Novorel. It's a 5,000 unit dose, but if that's not available with the pharmacy, they may substitute it with Pregnyl, which is a 10,000 unit dose. Only a 5,000 unit dose is absolutely needed for the triggering of your ovulation. So we are going to demonstrate with a bottle of Novorel. This bottle will be filled with powder, just a teeny tiny bit of powder at the bottom. This is not got the powder in it right now, it's just for demonstration purposes. Then you will have a bottle which is like saline or bacteriostatic water. It's a diluent to mix with the powder. So what we're going to do is take a small amount of this liquid and mix it with this powder. You should have received a syringe that has a needle attached to it. It's a larger needle than the one you're using for the injection. You'll have a separate needle for the injection. You'll need a couple of alcohol wipes somewhere to safely dispose of your needles and these two vials. So the first thing that we're going to do is we're going to pop the caps off of each of these vials. We're going to take our first alcohol wipe and we're going to clean the tops, the rubber stoppers on each of these vials. The next thing you need is your needle with syringe. We are going to take that out like this. The lid should be on there nice and snug. We're going to take the lid off. So with the Novorel, we're going to put 1 ml of air in the syringe, and we are going to put the needle through and inject the air into that. Flip it upside down, pull the needle where you can see it, and pull out 1 ml. You're going to go a little bit past the 1 ml mark because you want to get rid of any bubbles. Kind of tap those loose. Push it up until you get to the 1 ml mark. That's how much liquid you need for your injection. That comes off. So now you have your medication vial with the powder in it. You're going to take the needle and push all the liquid into that. Okay. So swirl this around, rock it back and forth until it dissolves. Do not shake it, because if you shake it, it is going to foam up and it's a little hard to inject foam. So nice and gentle. When you can hold it up to the light and see that there are no floating particles, that means it's dissolved and ready to go. So you're going to put your needle back in there, flip it upside down, and pull out. You might have to have your needle a little bit lower. There's a window on this vial here where you can see the needle through. So you're going to pull out. Well, if it's not pulling out, that means you're not low enough. all the liquid. You may need to push some air back in there. Tilt it a little bit to the side until you get everything out. Okay, so now I have 1 ml in here. I'm pulling back just to make sure I don't have anything in that needle. I am going to remove this needle, twist it. You're gonna dispose of that in your sharps container if you have it. If you don't have a sharps container, you can use a hard plastic soda bottle with a lid to dispose of those. So the important thing in keeping this clean is you don't want to touch anything that's going to touch the liquid that's going into you. So you don't touch the hub around the syringe. You're not going to touch the hub around the needle or the needle itself. So as we open this, open it like a banana without touching it. And then we're going to push that on and twist it till it's nice and snug. I did once have a patient who, when they went to inject their trigger shot, they pushed in the plunger and all the liquid just spilled out. So their shot was wasted. We don't want to do that. What I believe happened there was either they did not twist the needle on securely, or when they took the lid off, they may have made a twisting motion and loosened the needle. So we know the needle is on there nice and well. If there's any bubbles in here, you can tap it now before you take the lid off to get those loose. Okay, so we have air here, as you can see. We are going to push the plunger slowly up and watch. You're gonna watch the hub of the needle right there until you see the liquid go inside. As you push this up, as soon as you see the liquid inside, now you're gonna watch the tip of the needle. And then when you see a teeny tiny drop of liquid out of the tip of the needle, like that, that means it's ready. So this is the tricky part. The tricky part is that this is an intramuscular injection. Let me push this down out of the way. So the shot is going to go in your butt. What you're going to do in order to find the injection site is you want it in the upper outer quadrant of your butt. If you're giving this injection to yourself, I recommend using the side that your body feels most comfortable with. I am going to inject with my right hand because I'm right-handed. So I want to give it in my right buttock. So I am going to stand up for you. If you look at this as if it's a clock, okay? Find the center of the clock and you want to go in the upper outer quadrant. So the center, you can kind of divide it like that and then kind of pick right in the middle, like that. That's where I want to go. So you don't have to pull this down all the way, just low enough for that spot. You're going to need an alcohol wipe. Don't be embarrassed. This is all for science. Okay, so this is where I want to go. I'm going to wipe in a circular motion, starting at the center and working my way outward. Once I get all the way out, I don't want to cross back over because that'll make it dirty again. But I also don't want to stand up during this injection. What if I, get woozy, dizzy, and fall down? So I know that I want to do the injection here. I'm going to sit down and try to relax this muscle as much as possible. Don't push down with this foot or your butt's going to be all tight. If you do that, your muscle is constricted, and as you push this in, it's not loose and receiving, it's fighting it. So I have my spot, it's nice and clean. This is going to go straight in at a 90-degree angle. Okay, so you have your spot, find it right there. You want to hold it like a dart, like this. And when you go in, don't go in slow. You want to go nice and smooth and quick, just like that. And then once you have it in, you can do just a little bit of a pull on the plunger. And if you don't see blood rushing in, that means you're not in a vein, so you're good. So you push this in nice and easy until you see the plunger is all the way down at the bottom and the medication is in. Pull it out and you're good. That is your trigger. Oh my goodness, if this really had the Novarel in it, I would be ovulating in 36 hours. And if you're doing a natural intercourse cycle, not insemination or IVF, but a natural intercourse cycle, then later that night or later that day you would want to have intercourse, and then again the next day. But for an insemination, you want to hold off on the intercourse. Only do it when you're told to. Save the intercourse so that the sperm can be ready for when you ovulate. So here's the thing. If you have Pregnal is double the dose. 10,000 units. You only need 5,000. The only difference in giving this injection is you use less of it. You're only going to need half of it. So how do you do that? So the way you do it is, instead of taking 1 ml of saline and adding it to the powder, you're going to take 2 mLs of saline and add it to the powder. And then when you draw up your injection, you only draw up 1 ml, and that is half the dose, 5,000 units. Inject that. So if you have any questions about which amount you're supposed to do, you can check your calendar. It should say the amount to inject. If it doesn't, or if you're unclear about it, call your nurse, talk to her. The HCG trigger shot does have side effects that are similar to other medications that you may have taken if you're taking Menopur or Gonal F. Similar side effects. The hormonal things like moodiness or irritability, also stomach upset, bloating. If you have had a lot of follicles, like super stimulated, here, let me dispose of this so I don't wave it around. So this needle can go right in here, slide it in and twist it off and dispose of it. You can get rid of the needle that way too, but you don't have to. This can go in a regular garbage. So say you have done IVF and have a lot of follicles, or ovulation induction and you've had a lot of follicles. Your side effects are likely to be increased. You may get extra bloating. What I want you to do is weigh yourself every day. If you're gaining like 3 pounds a day, that's more than you should be gaining. There's a condition called ovarian hyperstimulation syndrome, and with that, you do get the extra bloating. It gets severe. When it gets severe, you can have difficulty breathing just because the bloating is pushing on your lungs. So if that happens, call your nurse immediately and get scheduled to come in, because there's things that they can do to relieve the extra fluids in there. Make sure that you're drinking plenty of fluids. Add a little salt to your diet to kind of balance out the fluids, make them go where they need to go. And again, weigh yourself at the same time every day so you can track and see if you're gaining a bunch of weight. If you do get pregnant following a trigger shot, then your HCG levels are going to increase. So you are more likely to have bloating issues and stuff as your pregnancy levels go up. Remember, don't do your pregnancy test too early. The thing that we measure in a blood test for pregnancy is HCG, human chorionic gonadotropin. So we've just given you HCG. It's going to show up in your blood for a while. But the levels will go down, and 16 days after your trigger shot is when we want you to do your blood test so that we can see if you're at a good level. Anyway, it wasn't so bad. I was expecting it to hurt more, but if you go in nice and easily, nice and quick, then it helps to relieve the discomfort. Don't use ice packs before a shot. I know a lot of people recommend ice packs, but that just makes the tissues all squeezed tight together. So don't do that. If you feel like you have to do something to relieve discomfort, a warm pack is better. So happy triggering, and I hope this helped.